What if you could lower your blood pressure without prescriptions, using things that might already be in your kitchen? Things like teas, even juices and roots, things that your grandma probably used long ago, but science is only just now catching up with. Sounds too simple, too easy, too good to be true, right? Well, just hang in with me. Today in this video, we're going to go over the top 5 home remedies that actually work for blood pressure. Number 1, beets. Now hang in there with me. Beets are full of nitrates. Nitrates are a chemical in the beets that your body turns into nitric oxide. You may have heard of nitric oxide. Maybe if you saw our video with Dr. Lou Ignaro, Dr. N.O., nitric oxide. He won a Nobel Prize by finding this chemical, nitric oxide, that naturally relaxes your arteries. It's not a chemical from outside. Your body even makes nitric oxide. And what is one of the biggest sources of nitric oxide for your body? Nitrates. So you may be asking, nitrates, nitric oxide, Dr. No, Nobel Prize, what does all that mean for me and my body? Nitric oxide is a chemical that your body makes to relax your blood vessels. Relaxing your blood vessels is what this is all about. That lowers your blood pressure. Now, if you're thinking like I used to think, I grew up hating beets. I did develop a taste for them. I thought they're a, quote, acquired taste. And if you're thinking, does this mean I need to eat 3 beet salads a day and get a juicer the size of a lawnmower and just overdose on beets every day? No, that's not the point. Let's make it simple. I know it can get complicated, especially when you have some concerns like I do. And I'm not alone. Most of us have this concern. A lot of beets have sugars as well. So how do we balance all of these things? Here's what I did. I just got a simple beetroot supplement and take that on a regular basis. With everything, there's also another word of caution. Have you ever heard of beeturia? Beeturia? It's beets in the urine. Beets can turn your urine pink. It's not a big deal, but just be aware. Don't get worried when you see it, if it happens. So remember, like all high fiber foods, some people get bloating with fiber. So be aware of the fiber in beets as well. The biggest thing to be aware of, I think, with beets is oxalates. If you've had kidney stones, be aware of this. Now let's go to another one. If I told you that there was an herbal tea that could lower your blood pressure by 10 points without medication, without other supplements, 10 points, would you believe me? It's a tea, and it's made from a flower. You see it a lot. You may have walked past it. My mom has a huge bed of hibiscus flowers. You can make a tea out of it. There's a couple of cool things about hibiscus. Believe it or not, a natural ACE inhibitor. ACE inhibitor stands for, again, technical geek speak, angiotensin conversion enzyme inhibitor. What is all this stuff? An ACE, an angiotensin converter enzyme, makes your blood pressure go up. If you've got an ACE inhibitor, it makes the blood pressure go down. In fact, some of the most important blood pressure medications these days are ACE inhibitors. You may have heard of one like lisinopril. So that's one of the biggest things about hibiscus tea. It's a natural, non-prescription ACE inhibitor. Now, there's something else really big about hibiscus tea. It also is an antioxidant, a natural one. So if you're wondering which ones, you may have heard of them, polyphenols. Those are the antioxidants that you see in hibiscus tea. But on a practical matter, you may know this. Blueberries, red wine. People say blueberries are healthy for you, red wine is healthy for you. It's because they have polyphenols. The same thing that you find in hibiscus tea. These polyphenols help with what we call endothelial function. Again, geek word, It just means the lining of the artery wall. So your artery wall has two major components that you need to remember. One is the muscles that hold it, and we loosen them up with those ACE inhibitors. The other part that's very important is the lining. It's where all the metabolic processes happen. The polyphenols help those metabolic processes. They help that lining, what's called the intima or endothelium. Now, if you've seen other videos on this channel, you might be familiar with the fact that one of the biggest risks for heart attack and stroke is what we call cardiovascular or arterial inflammation. So now you begin to see that with hibiscus tea, you're getting a double whammy. You're relaxing those artery walls to lower the blood pressure, but you're also decreasing cardiovascular inflammation. So again, just think of your arteries like garden hoses. We want to keep them clean, open, and flowing freely. So you start adding too many kinks, too many little blockages, and you start getting more and more problems. The pressure has to increase to get flow beyond that. Hibiscus tea helps both ways. It helps relax that garden hose, and it helps keep the kinks out. Now, studies have shown drinking 2 to 3 cups of hibiscus tea per day for 2 to 4 weeks can lower your blood pressure 10 millimeters of mercury. That's as much as a blood pressure medicine. It's also a good blood pressure medicine and very natural. So here are the doses of this medication. Put 2 or 3 grams of the leaves in hot water. Steep it for a few minutes, 10 to 15 minutes, and then drink 2 or 3 cups a day for a couple of weeks. So, ready for the side effects? All of these things have side effects. With this tea, you can get interactions with blood pressure medicines. Remember, it is like a blood pressure medicine. Number 2, it can cause some allergic reactions. They're rare, but they happen. It's similar to the ACE inhibitors. They have those too. Also note, it can speed up how you metabolize acetaminophen or Tylenol. So be careful if you're taking Tylenol. This next ingredient has been fighting vampires for centuries. Guess what it is? It's right here in your kitchen. It's garlic, especially aged garlic extract. You may not have that. You may want to consider getting some. Most people think of pasta sauces when they think of garlics. Please don't eat pasta, especially if it's a grain pasta. If it's a konjac pasta, that's a different issue. And I'm not going to go down that bunny hole on this video. But here's the simple thing. The simple thing is garlic has a couple of chemicals that help lower your blood pressure. And if you're a geek and you want to hear those words, those 2 chemicals, one of them you may have heard of, allicin, A-L-L-I-C-I-N, allicin. The other one is you might not have heard of. I rarely hear of it. S-allyl-cysteine. And I'm not going to spell that one. So again, it's fairly simple. It's like that concept with the ACE inhibitor, the natural ACE inhibitor in the hibiscus. You've got a couple of chemicals here that relax that muscle layer of the artery wall here in garlic, the allicin, the S-allyl-cysteine. Now, we try to avoid politics, but I have to make something that might be a political statement here. People get politically fired up about science these days. They also get politically fired up about just old folklore. The bottom line is, these are both. It's old folklore to use garlic, and it's new science. The evidence is clearly there. Garlic, hibiscus tea, both of them are excellent. Beetroot is good too. You just got to know how to use it. Some people take it as a tea. Some people put it on their food. I put it on my food. If you take it as a supplement, just 1 tablet in the morning and 1 in the evening. So if you're wondering about the difference between regular garlic, raw garlic, and aged garlic extract, it's just, quote, fermented. The bottom line is this is what it does. It's not as pungent as regular garlic. Aged garlic extract isn't as pungent. It also concentrates those chemicals, the allicin and the S-allyl-cysteine, and it stabilizes them. So in many ways, it's a better form. But raw garlic is still great. And yes, if you're wondering about cooked, so is cooked garlic. That's where I get mine. So another advantage to the aged garlic extract is if you take that rather than the regular garlic, you don't walk around all day smelling like a garlic festival. Ready for the side effects? Okay, so like the others, it can cause a little bit of bloating, a little bit of GI distress. Garlic can also thin the blood a little bit, so be careful if you're on blood thinners. Just check on it. You can usually take both. And the third thing is, like a couple of the others, it does have some interactions with some medications. So just check on the interactions before you take it. Now, next is a wonderful tasting red juice. I've taken a lot of it in the past, but I have a problem because of the sugars in it. I'd like to take a quick moment to introduce you to my metabolic at-home risk program. This is a real game changer for anyone thinking about your metabolic health and your longevity. And it's priced at just $169.50, so it's an incredible value compared to other programs that cost 3 times as much. And you can find links below to a special limited time promotional code. Plus, I've included a lot more information at the end of this video. Just last week, hundreds of other viewers invested in their health with this kit. Why not join them on their journey to a healthier and more fulfilling life? Now, back to the show. It's called pomegranate juice. That pomegranate juice has been shown to lower blood pressure by about 7 points. So before we talk about how to manage the problems with pomegranate juice, let's talk about what's good about it. It clearly does lower blood pressure. There's no question about that. And it's also got polyphenols. Remember those nice antioxidants. So it does both of those things, sort of like hibiscus tea, helps lower blood pressure and improves inflammation. Now, my friend Jesus would say, drink a cup of 8 ounces, 100% pomegranate juice a day. And I think that's great. I actually used to do that when I was his age or when I was younger. But the problem for me is I'm older and diabetic now. I do something different. I take a pomegranate extract. Now, with the hibiscus tea and the pomegranate, remember they are natural ACE inhibitors. One thing you might want to be aware of is you don't want to take a lot of those if you're taking some types of blood pressure medicines, the ones called ARBs, angiotensin receptor blockers. Again, geek alert and a little bit of complication. You don't want to take ACE inhibitors and ARBs at the same time. So just remember, if you're trying to control your blood pressure with lots of hibiscus tea and lots of pomegranate juice, talk with your doc about what medications you're taking for your blood pressure. If you're taking an ARB, like losartan, I'm taking that, then you don't want to try to control your blood pressure with a lot of hibiscus tea and garlic extract, because then you're taking both an ACE and an ARB. I do take, like I said, losartan, and I occasionally drink some hibiscus tea, and I get a moderate amount of garlic, but not enough doses of any of those to make an issue. Just be aware of it. If you're just early pre-diabetic, like Jesus, you can take pomegranate juice. You just need to measure your blood sugar and keep an eye on it. Now, this next supplement actually lowers blood pressure by 17 points. 17 points. Hawthorn is seen all over the world, and it's been used for eons, or maybe millennia, I'm not sure, a long time. Hawthorn is a small tree or native bush, again, seen throughout the world in more temperate regions. He also wanted me to give you the scientific name of the 2 chemicals that are in hawthorn that make a difference. I can't even pronounce one of them. I'm just going to give you one, though, because we've all heard of that. Flavonoids. So at the end of the day, hawthorn is like some of the other things that we've talked about, like garlic, like hibiscus tea. It helps relax the blood vessels, and it helps the metabolism involved in the lining of the blood vessels as well. And okay, I guess we've got to talk about science. Maybe list one study. Here's a 12-week randomized clinical trial, double-blinded. People took 450 milligrams of Hawthorn extract. They took it twice a day for 12 weeks. Nobody knew who took the placebo and who took the Hawthorn. But at the end of the 12-week study, the people that took the Hawthorn had much better blood pressure and metabolism. Specifically, diastolic and systolic. Remember, diastolic's the lower blood pressure. That dropped by an average of 9 millimeters of mercury. And the systolic, the higher one, 17 millimeters of mercury on 450 milligrams of Hawthorn extract twice a day for 12 weeks. Big deal. So, bottom line, this is a video about home remedies, supplements for blood pressure. If you're interested in doing that, Hawthorn's on the must-do list. And again, if you're unclear and wondering how does it actually do it, I know I mentioned it a minute ago, probably worth repeating. All of the mechanisms that we've talked about before. You remember we talked earlier about nitric oxide? Yeah, Hawthorn helps with nitric oxide. We talked about relaxing the muscle layer of the artery wall. Yep, Hawthorn does that too. We also talked about helping the metabolism, that lining of the artery wall. Hawthorn does that too. Now just remember, these are home remedies. They're like a supplement. And as you could see, even somewhat like a prescription medication. But supplements and medications are not a replacement for lifestyle. Lifestyle is king. And among the different lifestyle components like exercise and sleep, diet is most important. So let me make what I think is one of the most important points about this area. Blood pressure is a major increase, 5 to 8 times increase for stroke specifically. Stroke is the number one cause of permanent disability. I have patients come to me and say at first they're worried about heart attack. Then later on, as they get more mature in this space, they say, you know what, I wouldn't mind having a heart attack and just going nearly as much as having a stroke and being bedridden or wheelchair ridden for decades. So don't mess around with blood pressure. This is serious stuff. If you can't get your blood pressure down using supplements, you need to talk to a healthcare provider. So let me repeat again, just to make sure that you've heard this. If you have blood pressure problems, don't mess around with it. And if you think I'm saying, just go see a doc, go get on a blood pressure medication is going to fix it. No, that's actually not what I'm saying. What I'm saying is that blood pressure is one of the most common canaries in the coal mine. It's a common first warning sign that you've got a life-threatening condition that is the most important, the number one killer of humans worldwide. Unfortunately, it's way underdiagnosed. And in fact, medications are not the best way to deal with this. Lifestyle is. I created the video that you just watched because I have a passion about educating and empowering people like you to take charge of your health. It's the same reason why I created our metabolic risk assessment. This at-home assessment kit contains everything you need to work with one of our coaches to understand the details. It gives you a comprehensive picture and details of your metabolic health status. Using this information and the report that we develop, you'll spend an hour with one of our health coaches to understand your own unique metabolic needs and strengths. Now, all of this equipment is high quality. It's not throwaway stuff. You'll continue to use this for assessments and training during your metabolic health journey. And here's all the information that your coach will review with you from the report. Retail labs and online services charge over $500 for this. And here's the other thing. Those other tests don't even include the most important components, like the oral glucose tolerance test or the grip test. My at-home metabolic risk kit only costs $169.50. Yes, that's right, $169.50, less than $200. If you want to help a family member or friend, you can get an additional box. It's just $119.99. Our goal is to train and help 500 people just this month. We're well on our way. Let's hope one of those is you. Use the link below to start your metabolic health journey now. If you'd like to learn more about what I'm talking about, take a look at this video.